So we can classify the causes of low platelet count into three main categories. Now, to understand these causes, we must ask ourselves a few questions. First up, is there a decrease in the production of the platelets? Is the bone marrow functioning properly? Second up, after production of the platelets, whether they are surviving, is there decreased survival rate or increased destruction of the platelets? And thirdly, the platelets are mainly stored in the spleen. So we have to assess what is happening there. Is there increased sequestration? So the three causes are decreased platelet production, decreased survival of the platelets, and increased sequestration. Okay, so let's outline what is happening in each of these causes. First up, the decreased platelet production is the most common cause of thrombocytopenia. Well, it may occur due to either decreased megakaryopoiesis or ineffective megakaryopoiesis. Now, decreased megakaryocyte production and therefore the platelet production can be a part of a wider clinical picture. Now, the megakaryopoiesis decreases in the cases of either bone marrow failure, which is observed in aplastic anemia, bone marrow infiltration in metastatic carcinoma, leukemia, lymphoma, either multiple myeloma or myelofibrosis. This actually reduces the ability of the bone marrow to produce new blood cells. Well, drugs like thiazide diuretics, ethanol, and cytotoxins can also cause thrombocytopenia by several mechanisms. Those being either they are depressing the whole bone marrow and specifically impairing the megakaryocyte development or proliferation. Now, chemotherapy can also be a factor. Traditional chemotherapies basically work by wiping out fast-growing cancer cells, but they can also damage fast-growing healthy cells, like our blood cells, thus resulting in thrombocytopenia. Now, this condition is termed as chemotherapy-induced thrombocytopenia, or CIT. Viruses can also impair platelet production, mainly by invading the megakaryocytes, like in the case of measles. And also, HIV precipitates the development of anti-platelet antibodies and suppresses the megakaryocytes, causing thrombocytopenia in 50% of the patients. Now, coming to our second reason, which was the ineffective megakaryopoiesis. In this, impaired DNA synthesis in megaloblastic anemia due to vitamin B12 or folate deficiency results in ineffective thrombopoiesis. And in the case of myelodysplasia, where immature blood cells in the bone marrow are unable to form healthy blood cells. Now, this may occur due to prior exposure to toxins or carcinogens like tobacco, benzene, or heavy metals. The second cause of low platelet count is increased platelet destruction or the decreased survival of the platelets. Now, this destruction can either be immune-mediated destruction or non-immune-mediated destruction. In immune-mediated destruction, we either have certain autoimmune diseases, we even have alloimmunity, and even certain drugs can cause thrombocytopenia like quinine and rifampicin. Now, it is hypothesized that the immune response following an infection results in the circulation of antibody viral antigen complexes. Now, these complexes bind to the platelets, which are then removed by the reticuloendothelial system. A similar response can be seen in the autoimmune disorder that is causing aberrant immune responses such as systemic lupus erythematosus or SLE.
And in idiopathic thrombocytopenic purpura or ITP, antiplatelet autoantibodies are observed to destroy the circulating platelets.
Now, in the case of neonatal alloimmune thrombocytopenia, it is associated with the transfer of antiplatelet antibodies across the placenta from the mother to the fetus. The commonest cause is when the platelets of the fetus express PLA1, a human platelet antigen, and the mother's platelets do not. Post-transfusion purpura also occurs due to PLA1. Now, in this case, the donor platelets express the antigen PLA1, but the recipient platelets do not have this antigen. Now, drug-induced immune thrombocytopenia occurs via a variety of mechanisms. The platelet count is often less than 10,000 microliters of blood, which is way below our danger zone. And the patients present with acute purpura. Now, the drugs known to induce immune thrombocytopenia are quinine, which is used to treat malaria, and this should immediately be stopped if the patient becomes thrombocytopenic. In non-immune mediated destruction, first up we have thrombotic thrombocytopenic purpura, or TTP. TTP is a rare but serious disorder that mostly affects young adults. Microthrombi, which is the combination of platelets and fibrin, are deposited in the arterioles and capillaries, causing thrombocytopenia. Now, the etiology of TTP is usually related to antibodies that are produced against the von Willebrand factor cleaving protease. Now, moving forward to hemolytic uremic syndrome, also denoted as HUS. It is a disorder similar to TTP that affects infants and young children. However, in HUS, the platelet fibrin microthrombi are limited to only the kidneys. And in many patients, the disease follows recent infections with E. coli and other enteric pathogens. Dilutional thrombocytopenia is known as one of the major adverse effects that are associated with massive blood transfusion due to excessive blood loss in the patient. And it happens in the case when the transfused blood contains less amount of platelets. So, dilutional thrombocytopenia is caused by platelet dilution with red blood cells and crystalloids from the transfused blood. This brings us to the third cause of low platelet count, which is splenic sequestration. Do you remember in the beginning I told you to ask yourself a few questions? Well, we know that the platelets are stored in the spleen after they are formed in the bone marrow. So now if we ask ourselves, what is happening in the spleen that is causing platelet destruction? So, if a condition causes the spleen to enlarge, resulting in splenomegaly, the spleen will function abnormally, sequestering or destroying up to 90% of the total platelet mass that is stored in the spleen. Now, this will obviously result in the decrease in circulating platelets and cause thrombocytopenia in a patient. So these were the three main causes of low platelet count that you might observe in a patient. I hope you learned something new today. Get all the help that you need in your medical studies, only with sqadia.com.